ideas and put them together into one big plan.
Really?
And there's not anything in his plan that's going to save anybody any money.
Okay.
Healthcare costs are going to go up for the people who do have health insurance.
Well, Bruce, tell me about your practice. How many patients you have? Or what's the demographics?
I'm in a small town an hour south of Houston.
Okay.
I have a private ear, nose, and throat practice.
Okay.
And see a lot of patients with insurance, many people without health insurance.
Okay.
How's his plan going to affect them? Well, it's going to help the uninsured who are now going to become on Medicaid.
Right.
It's going to massively expand the Medicaid.
Really? Okay. So what about the people that didn't come see you
Well,
and need
the
a doctor?
ones with insurance are going to be paying more
Right.
for their health insurance because his plan's going to do such things as eliminate pre-existing clauses.
Right.
And with all these 30 million people now with coverage, somebody's got to pay for that.
Someone's got to pay. So
For those people who can't afford to pay, it's got to cost them more.
your message to the president is?
Start over. You got to have some free market incentives in there.
What would be the number one incentive?
Well, you have to have incentives on the part of the patient not to go to the doctor. You can't have very small copays. You have to have significant copays to keep the system from being overutilized.
Okay.
You can't have patients coming in demanding CAT scans and MRIs every time they have some minor illness because you get overutilization of the system. Because the CAT scans, the MRIs are just increasing exponentially.
Well, they tell me that electronic health records is going to make the difference.
That's not going to make any difference.
Why do you say that?
Well, the only thing it makes a difference for is in monitoring
Right.
patients. For example, if you use electronic health records, you see the patient, you create an electronic record, immediately that's available to the government or the insurance company, or will be available.
Right.
And then they can monitor to see if you're accurately coding for what you're doing.
Really?
So it's Big Brother, and there are some good parts to that. I don't mind that part of it.
Right.
But now that those records are out there on the internet, if they can steal your Visa card, your MasterCard number, your Social Security number, your health records are out there too.
There you go.
So
Okay.
there are a lot of privacy issues that are going to be created by these electronic health records.
Right.
What if people don't go to the doctor because they're afraid that their HIV status is going to be public knowledge
Or whether or not they use cocaine.
and they won't go to be treated?
So the word from Texas is that there's a whole lot more work to do.
Oh yeah, we
Okay.
just started.
Just started. All right. Thank you, guys.